Hi, all of you. Welcome back with another new topic. How do you explain light induced hyperpolarization in vision? Okay, let's now learn how to explain how this light induced hyperpolarization is brought about in vision. Now, what is a retina? Yes, retina, what is the structure of the retina? The structure of retina, you have the pigment epithelium, you have the photoreceptor layer in which you have the photoreceptor cells, rods, and cones that ends in bipolar neurons connected to ganglion cells and finally to the optic nerve fiber. So, this is how when light falls on your retina, the information is taken to your brain, right? So, it has to traverse through these layers of the retina. Now let's just concentrate on our photoreceptor cells. What happens in the photoreceptor cells? Rods and cones. Now the structure of rods and cones as it's shown in the picture, it has the outer segment, right? Outer segment that has a series of discs and also inner segment, and then it is having the terminal that is ending in your bipolar neurons. Now in the outer segment, you have discs, is it not? Now those discs are made of rhodopsin. In those discs you have rhodopsin. All right, in those discs, so suppose let us zoom into this disc. If the disc looks like this, we have the rhodopsin on it. Now what is a rhodopsin? Rhodopsin is a G protein coupled receptor. And what is it made of? It is again made of your opsin and 11 cis retinal. All right. Now, when light falls on the retina, what happens is phototransduction cascade takes place, right? What is that phototransduction cascade? So, this 11 cis retinal and opsin together you call the rhodopsin. All right. Now, when light falls on it, it gets converted to batho-rhodopsin, lumi-rhodopsin, meta-rhodopsin 1, 2, and 3. And finally, it changes to all-trans retinal plus opsin. All right. Now, what is this cis and trans? What is this cis and trans? It's nothing but changes in configuration. No. What is cis configuration? What is trans configuration? So, in this pertaining to this 11 cis retinal, there is a double bond between carbon 11 and 12. So, on either side of this double bond, the groups on either side of the double bond, if they are going to be on the same side, then that is cis configuration. If the groups on either side of the double bond, if it is going to be the opposite direction, then you call it as a trans configuration, right? Cis and trans configuration. So this, if this configurational change is going to happen, now this 11 cis retinal is present in your rhodopsin. So if this configurational change is going to happen, then of course your rhodopsin will undergo some conformational change, is it not? That is going to activate your rhodopsin. All right. So here, this is a protein. This is the your rhodopsin, and the rhodopsin has your 11 cis retinal. So that when light falls on this rhodopsin on your photoreceptor cell rod, and that is going to activate your rhodopsin that is present in your disc of the outer segment of your rods, is it not? So this rhodopsin, if it gets activated, it means that the 11 cis retinal is going to get converted to all trans retinal. So as it gets converted to all trans retinal, there is the the configuration from cis to trans that is happening. So your protein rhodopsin itself is going to get some attain some conformational change. All right. Now here, suppose let's zoom into this. This is what is the disc. Okay, they are showing the disc that we have seen here, right? If you can look into this picture, these are the discs, right? So let's zoom into those discs. One of the disc. So in one of the disc, it's shown that your rhodopsin is present. Okay, your rhodopsin is present. Now on this rhodopsin, the light falls, right? When the light falls, what happens? It is a G protein coupled receptor, I told you, right? So what is a G protein that is coupled to it? It is nothing but your transducin, right? It is transducin. Now this transducin has subunits alpha, beta, and gamma. All right. Now, when this when this rhodopsin is activated, it will activate transducin, which means that the alpha subunit of the transducin is going to get bound to GTP now, right? So previously, when it was in the inactivated state, it would be bound to GDP. Now, in the activated state, it will bind to GTP. So alpha GTP as a complex, it is going to get dissociated, and it will go and stimulate another enzyme which is present on the disc, that is the phosphodiesterase. Okay, that is going to be the phosphodiesterase. Now this alpha GTP complex, it is going to activate this phosphodiesterase enzyme. Now, what is the action of this phosphodiesterase? The action of which is to convert cyclic GMP. Okay, I'll write it here. The action of which is to convert, all right, it is to convert the cyclic GMP to GMP, 5' GMP. All right, now the cyclic GMP, how does this compound going to affect us? Now, since it is converting all the cyclic GMP to GMP, the levels of cyclic GMP are going to get reduced inside the cell. Now we have an ion channel on the cell membrane that is cyclic GMP dependent. Okay, we have the ion channel that is cyclic GMP dependent, which means only when cyclic GMP is bound to the ion channel will be opened up. What is this ion channel? This is a sodium channel. So we have a cyclic GMP dependent sodium channel on the cell membrane. Now, if our levels of the cyclic GMP are going to be reduced by this phosphodiesterase enzyme, now what will happen? The sodium channels will close. Is it not? Cyclic GMP levels are reduced and sodium channels are closed. So you don't have sodium influx inside the cell. All right, this is going to bring about hyperpolarization. Yes, this is going to bring about hyperpolarization. So this is what is light-induced hyperpolarization. Now again, let's just revise this. So initially what is happening? The light falls on your rhodopsin, right? Rhodopsin is made of opsin and Levin's retinal. Now that Levin's retinal is going to get configurational change to trans retinal. Yes, cis to trans. As the cis to trans change is happening, your rhodopsin is activated, is it not? So your rhodopsin, suppose this is a disc that we have. So the rhodopsin is present on the membrane. When this rhodopsin is getting activated, your transducin, yes, that transducin that is present on the membrane, that gets activated. That's the G protein. So that G protein, if it gets activated, has 3 subunits, alpha, beta, gamma. If you need to activate this transducin, then alpha will be bound to GTP. Now this alpha GTP complex is going to attach to phosphodiesterase enzyme. The action of phosphodiesterase enzyme is to convert cyclic GMP to 5' GMP. So your levels of cyclic GMP are going to get reduced in the cell. So along the cell membrane, we have the cyclic GMP dependent sodium channel. Now when the levels of cyclic GMP are reduced, the sodium channels will close. So there is no influx of sodium here. This is going to bring about hyperpolarization. All right. Now, what happens in dark in contrast? Yes, what happens in dark in contrast? That is, we have talked about light. Is it not? Light, during light, whenever light falls on your retina, the following reactions would happen. Now, what happens in dark? The opposite happens. Is it not? Your rhodopsin is not activated. Your transducin is not activated. Right? So, this alpha subunit of it will be bound to GDP. Is it not? So that is not activated. So that will not activate your phosphodiesterase enzyme. So your cyclic GMP levels are going to be increased inside the cell. Now this is going to open up your sodium channels, right? This is going to open up your sodium channels. So sodium influx is present. All right. Now, so in dark, what is happening? In dark, there is depolarization. In dark, there is depolarization. Right? So in light, there is hyperpolarization. In dark, there is depolarization. So what is the effect of this hyperpolarization in light? Yes. So when there is hyperpolarization during light, when there is hyperpolarization, what in it should bring about? It will bring about decrease in the decreased release of synaptic transmitter. The synaptic transmitter that they are talking about is glutamate here. Okay, it is glutamate here. Okay, now let's again come back to this picture. Here In addition, okay, in addition to your sodium channels, in addition to the sodium, you also have calcium that can enter. Okay, not just sodium, even your calcium, even calcium channels are available, so calcium also will enter. So in case when this ion channels are closed, what will happen? Calcium entry is also reduced. Yes, you need calcium to release your neurotransmitter from your synaptic terminals, is it not? You need calcium to release the neurotransmitter from the synaptic terminals. But since the calcium levels are less, what will happen? The neurotransmitter release is also less. So the release of glutamate being the neurotransmitter here, the release of which is less. Now the less release of this glutamate as a neurotransmitter is going to bring about response in the bipolar cells. Okay, so this is in contrary to other sensory neurons, okay, which are activated by depolarization. But here in photoreceptor cells, it is activated by hyperpolarization. So that's the difference you should know about. All right. So this is what is happening. This is what is the this is what is happening in light-induced hyperpolarization in vision. All right, all of you. So let's again just revise. Incident light, it brings about structural change in your rods and cones, and that is going to change your rhodopsin, that is going to activate your transducin. Now the activation of transducin is bringing about activation of phosphodiesterase, then that is going to decrease the levels of cyclic GMP. That will cause the closure of cyclic GMP dependent sodium channels. That is going to bring about hyperpolarization. Due to hyperpolarization, there is decreased release of the synaptic transmitter glutamate, and that is going to bring about a response in your bipolar cells. All right. Yes. So this is all about the light induced hyperpolarization in vision. All right. Hope you understood. So for more materials and guidelines, right? If you want guidance for preparing for your MD biochemistry, please do download the app Clinical Biochemistry. You will find the courses separately for MD biochemistry and MBBS biochemistry also. You'll find recorded lectures, live classes also will be taken, study materials will be available. If you want to know more about more contents, free contents in YouTube channel, please like, share and subscribe. Thank you all.